Good evening all. I'm Jerrin. I'm one of the OET and IELTS trainers of VHS. And I welcome you all to yet another live session of Dynamic Academy. Today in this live session, I would like to share some tips for your OET speaking. I'm one of the OET and IELTS trainers of VHS. Before we get into the topic, I welcome you all. Let me give you a brief idea about our company as well as the Academy learning. Why should you choose in this live session? I would like to share some tips for your OET speaking. I'm one of the OET and IELTS trainers of VHS. Before we get into the topic, I welcome you all. Let me give you a brief idea about our company as well as the Academy health staff. Why should you choose provides effective online learning? I would like to share some tips for your OET speaking. I'm one of the OET and IELTS trainers of VHS. Before we get into the topic, I welcome you all. Let me give you a brief idea about our company as well as the Academy health staff. Why should you choose provides effective online learning? I would like to share some tips for your OET speaking. I'm one of the OET and IELTS trainers of VHS. Before we get into the topic, I welcome you all. Let me give you a brief idea about our company as well as the Academy health staff. Why should you choose provides effective online learning? I would like to share some tips for your OET speaking. I'm one of the OET and IELTS trainers of VHS. Before we get into the topic, I welcome you all. Let me Good evening all. I'm Jerrin. I'm one of the OET and IELTS trainers of VHS. And I welcome you all to yet another live session of Dynamic Academy. Today in this live session, I would like to share some tips for your OET speaking subtest. And before we get into the topic, let me give you a brief idea about our company as well as the pattern of learning. Why should you choose DHS? So first of all, DHS Dynamic Health Staff, we provide an effective online learning experience to our candidates. And we are one of the Asia's biggest and ultimate virtual training partners with proven results. Now, let me explain you why should you choose DHS for your learning. Okay? So the first point I would like to share with you is the first highlighting element, that is unlimited practice hours. As once a candidate joins with DHS, they will be having a 2 months program at first. So once they complete their 2 months program, they will be allocated, they will be added to a new batch called practice drill session or group, where the candidate would be able to attend n number of sessions, which will be helpful for the candidate to practice their all 4 modules. Like mostly candidates would be completing their 2 months program. After that, they would like to book the date to appear the exam. But we, assist our candidates to practice as well before booking the date. They can even have another opportunity to practice with all our trainers. So this is another kind of an initiative taken by all of the trainers of DHS. All of the trainers are providing sessions in a day. So a candidate can attend minimum 4 hours of sessions a day, maximum as they wish, because all trainers are taking the sessions. So this is one of the benefits what you would be getting once you complete your 2 months program. You can practice your sessions without any limit. Next, we provide 100% interactive sessions. As when you attend the sessions with our trainers, definitely if you find any difficulty to understand anything, you may clarify your doubts with the trainers. There will be separate time which will be allocated to you to clarify the doubts. Probably at the end, we will allow you to spend 10 minutes to clarify your doubts. Other than that, we would be mostly all trainers are correcting the letters or everything on the screen so that you can understand what we are actually explaining, what corrections are being done. Everything will be quite clear. So a better communication is possible because it's not only a lecture a trainer would be taking. It's not just like that a trainer would be sitting in front of the screen and taking a 1 hour lecture. No, there will be proper presentations which will be available. Accordingly, we will be explaining that. So a better communication is possible over there. Next, let me explain you regarding the virtual trainings. As I just mentioned, you can enjoy the sessions at your best comfort. Also, as nowadays, if you are a working professional, definitely you may find difficulty to attend the sessions at a proper timing. So there may be difficulties that you may face. So we have decided to allocate 2 alternative sessions for a candidate so that according to your comfort, you can attend, either one session a day. So that's all about our virtual trainings. Next, unlimited mocks available. You must be knowing what is called mocks. Mock tests will be available on a weekly basis. We will conduct mock tests for the candidates to analyze, how the candidate is, practicing everything, whether the sessions are going on a proper manner, whether the candidate is on the right track. So both the trainer as well as the candidate can understand where the candidate is right now. Okay, whether there is anything which has to be improved, where they are lacking, what is the drawback. Okay, everything will be able to understand with the help of the mock test, which will be conducted on a weekly basis. Next is OET experts are your mentors. Definitely, I can assure you that our mentors will be helping you in the right manner as they are the experts. So, for all the 4 modules, you will be getting the best trainings at DHS with all our mentors. Next, we will be providing you the interactive e-capsules, which means, we are providing e-books. Other than the normal sessions or the regular batches, we would be providing you an e-books availability, which will help you to practice at your comfort. You can have the access of the same. You will be given the access once you are a part of DHS. Accordingly, as your comfort, you can get into it. You can practice with the updated materials which is available over there. Next, I would like to discuss about rapid revision session, which is another initiative by our trainers, which is exclusively for the candidates, those who book the exam and those who are appearing the exam. So we will conduct the session before the exam, maybe 2 or 3 days before the exam, we will conduct it, and in which we will guide the candidate how do they need to be prepared for the exam, how easily they can reduce their stress level, because mostly we know that before the exam you would be quite stressed. So that will affect the candidate to be, not confident to appear the exam. So we actually plan to conduct this exam this session, this rapid revision session, to give all the tips and tricks as a final touch before the exam. So, so that the candidate can revise everything well, as well as they can clarify their doubts even before the exam. Also, if you have any doubts, it can be clarified there with all the trainers. It's not only one session with one trainer, no, but most of the trainers would be there and they would be taking all the 4 modules over there. So you can have a better experience. Also, this will help you to reduce your stress level. All right, yeah. Next, let me get into the next point, that is mocks and assignments. Once you start your course for 2 months, definitely as you go on with your training with all the modules, the trainer will give you some assignments, which will help you to understand, okay, whether you are following the sessions properly. The assignments can be shared with the trainer according to a link which will be shared with you. Okay, and within 24 hours, you can mention the name of the trainer who needs to correct this particular assignment which you have submitted. This will be corrected within 24 hours of time without fail. Okay. Next is soft skill sessions. This is another important area which is required for all the candidates. Other than this OET or IELTS, the base is your soft skill. It can be grammar especially. So we provide a separate session, for all the candidates to make them understand what is a grammar all about. We will provide each and every single sessions. It will be a separate, normally we conduct 2 sessions a day for the grammar. One is at 1 p.m., the other one is at 7 p.m. So according to the candidate's comfort, they can attend either one. Same session will be happening in both the timings. Okay, so this is another initiative and another benefit which you will be getting as being a part of Dynamic Academy. Next is 24/7 learning LMS, which means you may not find any kind of difficulties once you get into the course, as consecutively. So to avoid such kind of a scenario, we are actually providing a separate another opportunity to be a part of our e-library, where you can access the videos, the presentations, as well as the materials, so that you can practice, you can watch the video, okay, with the help of the presentations. So this will help you a lot. Like if you're unable to attend the sessions, you can make use of this. Next is live shows. Yes, definitely you can be a part of our live shows on every Fridays at 5 p.m. So stay tuned for new topics, tips and tricks for all the modules. This will be quite helpful for you other than your normal course. Okay, all the trainers will be there on screen for the live shows. They will come up with new topics, updated topics. All right, yeah. Next is community support. Here definitely once you get into this DHS, you may find or you may have some queries regarding maybe the link which you need to have for sending the assignments, or maybe for the recordings, what to do, where to do. Many queries would be there once you join. All these will be clarified with the help of your admission advisors. If you have any queries, you can contact them immediately. They will help you out with the query. Okay. So that's all about the highlighting elements of DHS. Why should you choose us? So I hope this is quite clear for you all. Now let's get into our topic today, which is the tips for OET speaking. Yes. As you all are aware, OET speaking is one of the important modules in our OET subtest. Okay, in our OET test. And OET speaking, which consists of 2 role plays. Yes, and along with a warm-up session. At the time of examination, you will have to enact 2 role plays as well as a warm-up session, right? So the warm-up session, as you know, once you get into the particular exam room, you will start with the warm-up session, which means you will be asked a few questions related to your profession, just to make you comfortable, as well as the interlocutor, who will be the person will be sitting in front of you. We call them as the interlocutor. He or she is not going to assess you in any way, but they will ask you certain questions which will be helpful for you to make you comfortable for the particular session. Okay. Once it is done, you will be given a role play card. The first role play that will start. You will be given a role play card, and you can spend 3 minutes to prepare for the same, and you have to perform for the next 5 minutes. This will happen accordingly as 2 role plays to be performed in the same manner. So how this conversation or this performance will be assessed? As you all are aware, Your audio will be recorded. The conversation, this will be recorded, and the recording will be assessed by two different assessors. According to your two role plays, your speaking will be assessed not only on the basis of one role play, but on the basis of two role plays. All right. And you must be having some doubts related to this OET, the role play cards, and the performance. So let's have a look at that. You may think, can I write on the role play card? Definitely yes. You can make notes on the role play cards if you want. And you can refer to the role card at any time during the role play. You must return the card to the interlocutor at the end of the role play. So, what you can understand from this? You can, if you want, you can write on the role play card as whatever you want in that 3 minutes time duration. Also, you can highlight the points. What are the main points to be explained about? You can underline, you can highlight in any way. Also, you can write your points. And also, once you start your performance, you can even look at the role play card if you want. Okay, there is no kind of a penalty will be there as if you look at the role play card and all. It is possible. That's your privilege, which you can even do. Okay, but the thing is, once it is done, the role play card to be returned back to the interlocutor. Hope that is clear. Next is, what if I don't finish role plays? Okay, this is a common query. Normally, I will be asked, this kind of a query when I take the the session, speaking sessions. Each role play is designed to elicit an accessible sample of speech which reflects your speaking ability in a health profession context. It is usual for a role play to come to a natural end at around the 5 minutes mark. Okay, if this does not happen, the interlocutor will signal clearly that it is time to conclude the role play. So, in your role play, it is better for you to finish all the points, on time, as you have 5 minutes to complete your role play performance. If possible, try to cover all the points on time. In case, if you are unable to finish all points on time, don't worry about it. How do you perform or what do you perform in that 5 minutes time would be assessed. Okay, there is no penalty for the same, but it is better you can plan well. That is what, there is no penalty for not completing all the elements on the role card. However, the more elements of the role play card you cover, the more evidence you are likely to give of your ability to communicate in spoken English. So, what you can understand, if you are trying to cover most of the points, definitely you can show that how eligible you are in the speaking. Okay, whether you are following all the criteria as well. Unless you are, covering all the points, then, the chances are very less. You cannot show your ability over there. But if you are covering most of the points and if you're speaking more, definitely that will help you a lot to score better. As well as use the preparation time to think about which elements of the role play might require you to explain something in more detail or to ask the patient for more clarification. So the 3 minutes preparation time is crucial. Always you need to spend that 3 minutes effectively. Think about it. Think about the role play. Always I suggest my candidates to imagine the situation. Once when you get the role play card, please just understand the setting where this conversation takes place. Then you read the background information. You will come across whom you are going to speak with. Is it a patient or the carer? Then what is the condition of the patient? Why I am going to speak with this person? Then also some of the other relevant details would be given there in the background info. Once you understand this, please imagine this situation in your mind so that you can have a better communication. If you are considering it as a task, I, 100% sure that, you cannot perform well. But if you consider it as a, a real life scenario, if you can imagine it in your mind, definitely I assure you that the performance will be very, very good. So please have it try. Try to imagine this situation in your mind. Then you prepare well. What are the points? Do I need to ask any questions? So what are the questions I need to ask? You need to prepare it on the paper. Also, the main keywords is given on a role play card. Like you can see, sometimes you will be given the keywords like ask, or maybe assure, reassure the patient, explain, then provide information, emphasize, so and so. So these are the main keywords, which gives you an idea. What do you need to do over there regarding that task? What are you going to do? Ask or find out means definitely you need to find out something. You need to ask questions. Only by asking questions we can collect information, right? Next is explain. As you know, you're going to explain certain things. Next, assure. You need to provide assurance to the patient. Sometimes you have to advise the patient. So that is an advice or suggestion, or maybe emphasize. Emphasize means you need to give more stress to that point. You need to explain it well. So these are the keywords which you will come across in a role play card. Okay, this is another important thing you need to have in your mind. Go through the keywords, on each task given. Then you prepare well. Accordingly, you can start your conversation. And very importantly, one more thing I would like to suggest you, that is, normally I notice one thing. Whenever I conduct the speaking sessions for the candidates in, DHS, what I notice is every candidate prepares everything except an introduction. Always. So what happens is, even in examination also, you will be given 3 minutes time. You will prepare everything except the introduction. And all of a sudden, when you are asked to start the conversation, the performance, you may get panic and you cannot perform well. The introduction will be completely wrong and it will be messed up. And after saying the introduction, you come to know, you realize that what I said is wrong. And this, problem which will be haunting you throughout the conversation, throughout the performance. And that's how you cannot perform well. See, what is the point in regretting in such a way? So always make sure you prepare your introduction at first, then only you are getting into the other points as the preparation. So this is good for you, as if you prepare the introduction as well as the other points. Don't skip the intro. You may feel that, okay, it's just a matter of introducing myself and just to ask so and so. I don't need to prepare. But I assure you, if you don't prepare your introduction, and all of a sudden, if you're asked to perform, you may get panic. You will get nervous. And you may say something else, as what you have already planned in your mind, you will forget. Your mind will be blank. You cannot even perform on the manner, how exactly you planned already. You will say something else only. Please try to avoid such kind of a scenario. To avoid the same, it is always good to write the introduction. It won't take much time. Okay, please try. Even you can practice in the same way next time onwards. Okay. Next, as you all aware, there are two main criteria in our OET speaking. One is linguistic criteria and the next one is clinical communication criteria. So why do we have this criteria in the speaking? See, your speaking subtest, as we have already discussed, your audio will be recorded and this recording will be assessed by two different assessors. How are they going to assess this particular audio? On the basis of what? On the basis of this criteria. Okay? Only according to these parameters, they will be assessing your speaking. Not just, even if you are fluent in English, it doesn't matter unless you know this criteria, and if you're not following the criteria, there is no point in speaking well. Because OET speaking is not only assessing your language skill, but also your clinical communication skill. So this is one of the criteria you need to follow. So please be aware about, please be familiar with all criteria. And you need to make sure that you're following all the criteria as well in your speaking. Unless you are aware about this, there is no point in practicing. Okay, so let me just brief you the main criteria. and how do you need to be careful about it? First of all, linguistic criteria, and the sub-criteria are intelligibility, fluency, appropriateness of language, resources of grammar and expression. Next, when it comes to clinical communication criteria, here we have relationship building, understanding and incorporating the patient's perspective, then providing structure, information gathering, information giving. Now, let's have a detailed look of all these. First one is intelligibility. That's a sub-criteria of linguistic criteria, in which you are it will be assessing whether the examiner can understand what you're saying. Also, your voice should be clear. You need to pronounce the words correctly. Then you should not speak too fast or too slow. You need to maintain a natural rhythm. Okay, make sure that you're not speaking too fast or even speaking too slow. That won't help you in any way. That will be affecting the criteria intelligibility. So try to maintain a normal, a natural rhythm. Okay, that is always good. Also, if possible, if it is required, you can give stress to the word and intonation. Then when it comes to fluency, it is all about the smoothness of your speech. How smoothly you are speaking. Whether do you pause it for a long time or not. Whether you use excessive usage of filters. How smooth it is. That's all about fluency. Okay, so better try to avoid the pauses for a long time. You should not do that. As well as try to avoid the excessive use of filters. Filters in the sense it can be some kind of humming voice like likewise. This is this tendency. Most of the candidates I usually notice. So try to avoid such kind of a thing. You can practice it. You can avoid the same. See, as a human being, definitely we can have this kind of a usage of filters, but excessive usage to be avoided. That's the point. Okay, that's all about fluency. And the next one is appropriateness of language, in which it will be assessing the use of suitable professional language, whether you are using a professional language or not. Like you may speak with the patient, and sometimes you may use some words not in a professional way, but that is not good for you. You need to make sure that you speak in a professional way. Okay, as well as whatever you explain when you talk about maybe regarding a surgery or maybe regarding any disease condition, if you just talk about that the main name of that disease condition or the surgery, the patient or the carer may not be able to understand it. If you're not satisfying the needs of the patient or the carer, or if you're not making it clear to them, that will be affecting this criteria, appropriateness of language. Even yesterday, when I was taking a speaking session, I happened to know, or I just noticed one thing. When I was enacting the role of the patient, the nurse, the candidate was actually explaining regarding the surgery happened to patient's husband. That was an embolectomy. Okay, but you just think about it. If you just explain to the patient that, yeah, actually your husband has undergone a procedure of embolectomy. So what do you think? The patient would be able to understand what is that procedure all about? Okay, so you need to make it clear to the patient or whom you're speaking with, because they don't belong to this medical profession. You need to use very simple terms. Even if you use a name, the medical usage, you are supposed to explain it to the patient in a simple manner. Also, the word vital signs. If you just tell the patient, okay, I would like to check your vitals first. Is that okay for you? The patient will wonder, what is called vital signs? That is not a common usage. That is a medical usage, which commonly used in a medical context. Okay, so you need to make sure whatever kind of usages you are using in the speaking role play, that has to be clear to the other person. That's your responsibility to make sure. Hope that is clear. Next is resources of grammar and expression, which assess the range of vocabulary. So, how easy it is for you to use the range of vocabulary. I mean, you will be given some keywords and sentences in your role play card, but that is not enough for you. You need to use good usages, even the paraphrasing elements to be there. You can paraphrase the keywords which is already given in your role play card. Then apart from that, you need to be able to that's what paraphrasing. Then form questions correctly. Definitely, if you come across the keyword in your role play card that is find out or ask, which means you have to prepare or form some questions, right? So always, which type of question is good? There are two main types of questions. One is open-ended, the other one is closed-ended. Open-ended questions means you may ask questions with what, which, where, when, how, who, whose, these kind of questions. Okay, what kind of exercises do you do? What about your daily habits? Okay, these kind of what, which, where, when, WH questions are called as open-ended questions. Closed-ended questions means, do you exercise? Okay, do you drink? Do you smoke? So for these kind of closed-ended questions, you may get only a specific answer. It can be either yes or no. So that may not help you to get more information. Always you need to focus on to the open-ended questions, which will help you to gather more data in a very short span of time, so that you can manage your time, you can save your time, you can get into more points. Okay, so always focus on to open-ended questions in your role play. So that is all about resources of grammar and expression. Next is indicators of relationship building, which comes under clinical communication criteria, in which it shows that you are interested in building a professional relationship with your patient or patient's next of kin. If you're talking to the patient or patient's carer, you need to make sure that you would like to build up a professional relationship with them. Okay, next one is a greeting. Always you need to make sure one thing, as you greet the patient when you start a role play. That's your responsibility, because according to the time when you speak, when you have this conversation, the performance, you should greet the patient first. Let it be known or unknown. But greeting is always crucial and a vital part of the role play. If you don't greet the patient, definitely that will affect the criteria relationship building. Next is you need to use a right tone in a respectful and non-judgmental manner. Say for example, if you mention, when you talk to the patient, you say that, I'm so sorry to tell you, you are a diabetic patient. See, avoid the usage of patient and all, because it is always better to avoid such kind of usages, which is not respectful as well as in a judgmental manner. Okay. Then empathy. Showing your empathy is another criteria. Always you need to make sure whenever you listen to something which is not good to hear, or maybe the patient is quite concerned and worried or anxious about something, and you are asking a lot of questions related to something. Whenever you listen to something like that, you need to show your empathy. Rather than, giving the answer immediately, you can show your empathy in a very different manner. There are so many ways to show your empathy. Yes, Mrs. Daisy, I can, understand your concern. Your concerns are quite reasonable. I can understand your perspective. There are so many usages which you can apply over there, okay, for showing your empathy. So don't worry, we are here to help you. You are in the safe hands and you are at the right place. Okay, you will be all right soon. I can assure you that, yes, the treatment has already been started, so you will be all right soon. So no need to worry about it. There is nothing to be alarmed about. So you're showing your empathy as well as you are giving an assurance along with it. So these kind of usages are really helpful to score better. Next is understanding and incorporating the patient's perspective, which means the impact of how fully you involve the patient in the conversation on your listener's understanding and comfort. Obtaining the facts of the case as well as the patient's ideas, concerns, and expectations. So you need to give room to the patient. Mostly I notice that sometimes candidates will forget to give room to the other person to speak, because you are concentrating only to your role play card, as you feel that I have almost 10 tasks to cover. So I cannot give much time to you to speak. And also, sometimes when I enact the role of the patient or the carer, I would be simply sitting for the 5 minutes. I would be a listener only. I won't even get a chance to speak, which means, the candidate is concentrating only on the role play, card, and they are focusing over there. They try to, explain all the points one by one. But that is not good for you. You need to give importance to the other person as well, because this is a two-way communication. You need to make sure, equal importance is there. You need to make sure the same, okay? As well as you can ask the patient whether they have any other concerns in between, whether they are able to follow the same what you are explaining. So check the understanding level of the patient. Always when you explain something, you can check it as whether the patient is or the other carer is able to understand what I'm trying to say. Make sure that you can use some phrases for that. I will explain all that later. So understand how this will be affecting according to the criteria. That is what I'm explaining right now. Next is good to do a repeat back. What is called a repeat back? A repeat back means whatever you have explained as of now can be repeated at the end. As when the patient says that she doesn't or he doesn't have any more concerns, you can just tell them, okay, so let me summarize what we have discussed as of now. As I assure you that if you follow all my instructions well, definitely you can have a speedy recovery. You will come, you can be away from these issues and all. You can get rid of it. So please try to start doing some exercises. Also, have healthy food, include more fruits and vegetables in your diet. Like this, you can summarize the points like you are repeating, doing a repeat back over there. Hope that is clear. All right, so let's get into the very next criteria, which is providing structure, which means the impact of how you organize the information you provide and introduce new topics for discussion on your listeners' understanding. So which means you must be noticing some task in your role play card, and when it comes to the performance, you may find it difficult to organize it, right? So mostly I notice it when the candidates perform their role play performances. Sometimes they would be trying to, or follow the same sequential order. But it is not mandatory to follow the same sequential order. You can decide how you can organize all the points. Maybe your second task and the fifth task are related, so that you can, merge those points and you can discuss, you can explain those points together. It's not mandatory that you should say the fifth task at that time only. No, that's up to you. You can decide it. So plan it very well when you get the 3 minutes time for preparation. Okay. So that is related to providing structure. And also you are in charge of the conversation, which means even if it is a non-case or a non-case, it doesn't matter. Always you are the one who needs to take the initiative to start the conversation. So make sure that you would start the conversation very well. So you are preparing your introduction well. Then signposting. Sometimes maybe, you will come across a task that answer to the patient's question, and the patient is not even asking you this question. Okay, so what you can do, you can even give them a hint, as they are not even asking us or they are not even talking about that point, which means you can give them a hint. You can ask the patient that, have you ever heard about this condition what you're having right now? So the patient will tell you, will give you a response. Accordingly, you can talk about it. Otherwise, it will be difficult for you. You will be waiting for the patient or the carer to ask you the question, and they are not even asking. You may not be able to explain. Okay. So to avoid this thing, just signpost it if possible. So the very next criteria is information gathering, in which the impact of the type of questions you ask and how you listen to the responses on your listeners' understanding. Then utilize active listening techniques and minimize interruptions while patient speaks. You need to make sure you don't interrupt the patient while they are speaking. Because normally I notice when I nag the role of the patient, when I try to speak, the candidates, they would be, interfering, or they will interrupt me. They won't allow me to speak sometimes because they are in a hurry to finish all their, topics or the task. But you should not do that. You need to make sure you involve the patient in your conversation and you allow them to speak. Okay, both of you have equal importance there. So don't forget it, don't interrupt them. But maybe in some cases, you feel that your interlocutor speaks a lot and you are unable to speak. At that moment, you can interfere, you can ask them to wait for a moment and you can explain the point, what you would like to say. Okay. Then use open questions in the beginning rather than closed questions. As you must be aware that what is all about open-ended questions and closed-ended questions. We have already discussed about it. Always it is better to use open-ended questions, which will give you more information. That is called information gathering, as you are going to collect more information about the patient. Accordingly, you can give suggestions or advices. All right. Now let's move on to the final criteria, that is information giving. The impact of how you provide information and check this information is being understood. On your listeners' comfort and understanding, always try to discover if the patient needs further information. So, it's very, very important that you should be careful, how you provide the information and check the information is being understood. I always suggest the candidates that you need to check the understanding level of the patient immediately after explaining something. Maybe you're discussing about the disease condition, what the patient is going through, okay? What the patient is experiencing right now. After explanation, see, whatever information it may be, you need to make sure what you are explaining is, is clear to the other person. They are able to follow you. So you can use the phrases to check the understanding level. Are you able to follow me? Is it clear to you? Am I clear? So far clear? Likewise, you can apply such kind of phrases to make sure they are able to follow you, so that you can involve the patient as well. So this is one of the criteria, so you should not forget it. Then always try to discover if the patient needs further information. Very importantly, towards the end of your conversation, finally, before your conclusion, you should make sure that the patient has no more concerns. As do you have any other concerns? Is there anything else which is bothering you? Just make sure, as there is no more concerns as they are having, and you satisfied all of their needs. Okay, so I hope that is quite clear for you all. Now we have completed all the criteria. Now I would like to get into a new topic, which is I'm going to explain you regarding the phrases, the importance of phrases in the speaking role play. OET speaking role play is the formal setting in which it is important to be polite and respectful. Hence, the usage of phrases comes into the role. Here, we will discuss different phrases that can be used in your OET speaking role play. For easiness and to understand clearly, we categorize the phrases accordingly. You can consider this as the best tip for your OET speaking role play. Let this help you to score a B grade in your OET speaking role play. Now, let me start with the phrases for seeking approval or consent. How to seek the approval or consent? As you are aware that before asking questions, we must seek the approval or consent to the patient or carer. So how to do that? May I ask you a few questions to get a clear picture about your condition? Or can I have a word with you, please? Or could I know more about your health condition, please? Would you mind if I ask you some questions about your habits? Do you mind if I adjust your bed height for you? I will provide one more pillow. Is that okay for you? Or I will provide some dietary patterns for you. Is that all right? So these are some of the phrases which you can apply. So better you learn some of the usages and keep it in your mind so that when you perform, you can use it instantly. You may not find any difficulty. All right. So now let's get into the very next phrases. Okay, before that, let me explain you I'll give you some idea about when you deal with a home visit. Always make sure this is a setting where you need to make sure that you will have a better introduction here. As if it is a home visit, you will start with the greeting first. Good morning. My name is Maria Parker, one of the registered nurses working in this community area. Am I talking to Mr. Sam? So the first important thing is you need to make sure the person whom you are speaking with. If possible, you can make sure the place as well, as if you are at the right place or not. Am I at Mr. Sam's house or is it Mr. Sam's house? Then am I talking to the right person or am I talking to Mr. Sam? Then finally, you are explaining the reason why you're there. As your doctor requested me to get in touch with you. Is this the right time to talk with you? Like you are confirming the time also. So this is very important. You must be careful about when you deal with the home visit. Next is showing your empathy, the phrases which you can apply when you show your empathy. I know it's challenging for you, as whenever you can show your empathy, like when you listen to some concerns, as the patient is quite concerned about the patient's condition, as you're asking the patient, how do you feel now? According to my knowledge, or I've gone through your case note and I came to know that you are being diagnosed with a skin problem, or maybe myocardial infarction, or so and so. Then how do you feel now? Or maybe the patient has undergone a surgery. So I've come to know that you've undergone a surgery for your thyroid gland removal. So how's your post-operative days? How's everything going on? So the patient says, reply you that, I'm so sorry, nurse, I'm not feeling well. It's very difficult for me to cope up. I'm in, complete pain and all. So when you listen to something which is not good to hear, or the patient is having more concerns and all, what you can say, don't answer to them directly. Instead, you can show your empathy there. How to show, okay, I can understand your concern. This is Daisy. I can sense your feelings. Okay, anything you can say as you're showing your empathy there. Then you get into the point, what you can do. Don't worry, you are at the right place and we are in the safe hands. So definitely we will take care of you. You will be better soon. This is quite common for all the patients, those who undergo this kind of a surgery. So there is nothing to be alarmed about. Okay, I know it's challenging for you. Or maybe I can see why you have this concern. Or I can understand your concern. If I were you, I would react in the same way. So learn some of the usages like this so that this will help you a lot. Then I can sense how hard is your situation right now. Then I know being a parent, or I know being a son or daughter, it's quite difficult for you to understand, or maybe it is difficult for you. Or I can sense that, I can sense that must be hard for you. Any such kind of a usage is required and it must be learned and used. Then only you can score better in your performance. Next, how to check the understanding level of the patient or the carer. You can ask, is it clear? Would that be okay? Do you have any other concerns? How does that sound? Does that sound good? Are you getting my points? Do you have any other difficulties? Is there anything else that is bothering you? Do you understand so far? Then are you able to follow me? So any such kind of a question will help you to check the understanding level of the other person. As immediately after explanation, you need to have this kind of some phrases with you. Okay? Next, how to reassure the patient. Definitely in some cases, you will have to give assurance and reassurances. How to do that? There is nothing to be worried about. Let me assure you that if you follow my advice, the risk of future problems will be greatly reduced. There is nothing to be overly concerned about. The symptoms are acceptable and seen in most of the patients. Don't worry, we are here to take care of you. You are in safe hands. Okay, you can even rearrange or you can reconstruct in your own way, not a problem. But this is a mandate thing, which means you must have some usages for assuring the patients. Okay, and your concerns are understandable, but please don't worry too much. We're here to help you out. So say something like this. This will help you a lot. Next, let's discuss about some phrases which will be useful for providing advices and suggestions. I normally see candidates use normal casual usages such as, you should not do that, you should do this, you have to do this, he has to do that. Avoid the usage of you have to, she has to, you should do, instead, I can suggest you some good phrases which will be helping you to score better. Like, it is recommended for you, or it is recommended to follow a healthy diet. Okay, as you're obese right now, it is recommended to follow a healthy diet hereafter. Then it is advisable to start doing some exercises. Also, it is highly recommended to continue your medications after discharge. Then I strongly suggest you to include high fiber or fiber-rich food in your diet. Then I advise you to reduce your alcohol consumption level. These all are some positive usages. Okay, when you suggest some positive ideas, you can use all these in a positive manner. At the same time, you may be suggesting the patient to, to know to do something. Like even today also, when I did one performance with a candidate, she told me that, she was saying the sentence like, you don't do this. You should not do this. Instead, you can apply this usage. It is not recommended. It is not recommended to give more stress or maybe to pressurize your vocal cord. It is not recommended for you to speak too much, which will, maybe which will give more stress to the, the surgical area, which will be leading to further complications. So you can suggest in this manner rather than saying you should not do this. You don't do this. Okay. Also, it is not advisable for you to do like this. It is not advisable for you to continue your smoking habits. That won't be good for you. Okay, so whatever information that you're suggesting in a negative way, that can also be in this manner. Instead of you should not do, you don't do, likewise. Instead, you can use it is not recommended. It is not advisable. Okay, so learn it so that you can use it instantly whenever it is required. All right, so next. Okay, so finally, we would like even, we can just conclude with the help of the points to remember. Okay, what are the main points which has to be remembered? First of all, understand the setting. Then ensure the person you're going to speak with. Next, confirm whether it is a known or unknown person. Next, prepare your introduction without fail to avoid making you panic and have a smooth conversation. Next, point out the phrases for showing empathy. Form questions correctly. Check the understanding level of the patient or carer. Apply phrases for advices and suggestions. Do not forget to involve the patient in your conversation. Ensure the patient has no more concerns and always have a better conclusion as well. So these are the points which you need to have, you need to remember when you deal with a role play card. As we have covered most of the relevant things and the main points which has to be remembered while dealing with a role play card and when you have a performance. Okay, don't forget all these points. Because if you follow these all in a proper manner, definitely, nothing will stop you to get a score beyond 350. Okay, it will be easy for you to score, beyond 350 or 360. So please try to follow the instructions and phrases as we have already discussed about the phrases which you can apply for the, areas wherever it is required accordingly. As well as there are certain things which is related to your criteria. As you are aware, your speaking role play will be assessed only according to the criteria. So please follow the criteria as well. Then only you can score better. Otherwise, even after the examination, you say always candidates say that, ma'am, I did it well. When the results come, they say that, ma'am, I did well, but I got only 340 or 330. Why is it so? why didn't I get 350 or beyond that? What may be the reason? Because I'm sure that I did it well. The reason can be just because of any one of the criteria that you didn't satisfy. So make sure you satisfy and you follow all the criteria as well. Then you can be confident enough that you will score beyond 350. It is possible. So make sure that you follow everything well. Okay, so whenever there is, it is possible for you to attend the practice drill session, attend the same and follow everything well. Just practice well. So definitely, I wish you all the very best to get a good score in your speaking subtest in your examination. If you follow all this well, definitely it is possible. All right, so that's all about today's topic. I hope I could, give you some tips and tricks to get a good score in your OET speaking subtest. Follow the same. As you know, we will provide you flexible timings to attend the sessions. Those who are watching my live session right now, please note it down. See, we are here to help you with flexible timings. If you are a working professional, don't need to worry about the timings as you are not available at this time or that time. No problem. We are here to help you, as we'll have different timings available. So we can schedule different timings for you so you can attend the sessions according to your comfort. Okay, so please, make sure that you will contact our admission advisor as early as possible. If you would like to join with us, please contact this number, which can be seen below. Please contact them immediately to avail all the benefits what you will get from DHS. Okay. I wish you to be our next achiever. It is possible as OET superhero boards are almost full right now. Thanks to the entire team for explicitly outstanding results in 2020 and continuing the same legacy for 2021 and 2022, which is actually continuing right now. Even today, we have got two good results. One was a UK score and the other was a Ireland score. More, we are waiting for the other results. Okay, so please join us soon and you can be our next achiever. So you are the next. Okay, next I would like to introduce our expert mentors, those who are working with us in this DHS. First, myself, as you could see, as I've got the certification from British Council and IDP, and I've been dealing with both OET as well as IELTS for last 2+ years in DHS. Next is Dr. 𝐸𝐸𝐸𝐸𝑚, who is the doctor by profession, who is a dentist by profession. And she has been dealing with both OET as well as IELTS. She has almost 8.5+ years of experience. Next is our most experienced person, most experienced trainer in our academy, who is Ms. 𝐕𝐸𝐸𝐸 Chatterjee, who has also got the certification from British Council and IDP. She has been dealing with IELTS as well as OET. Next, Ms. Sheetal James, who has completed her MSc in nursing, and she is a nurse by profession. So she is dealing with OET as well as IELTS. She has almost 9+ years of experience in this field. Next, I would like to introduce our male faculty, who is Dr. 𝐿𝐻𝐿𝐻. He is also a dentist by profession and who is dealing with both OET as well as IELTS. Next is Ms. Daisy, who is none other faculty, who has 3+ years of experience and who is dealing with both OET as well as IELTS. So this is what I would like to show you, as these are our expert mentors who is there to help you out to achieve your goal, as all of you are having a goal to move on to a dream destination. It can be either UK or Ireland, wherever it is. Please follow the instructions by our trainer so that definitely you can achieve your goal. I assure you the same. Please contact us immediately if you would like to avail the benefits what we will provide you from DHS. Please, please, please contact us immediately. Okay, so here is your free gifts. Okay, you can have 24/7 extended support. Okay, so you will be contacted by our expert admission advisors. If you can just give a missed call or message to this number, definitely we will call you back immediately. As well as we will provide you unlimited training hours. Okay, so please contact us for more details. We will guide you in a better way. As well as if you contact us right away in another 24 hours, definitely you can have 10% off for the course fee. Okay, so that's all for today. And now we will be waiting for your call or message. So wish you all good luck to all of you. Thank you once again.